hospitals in the Eastern Cape are filling up once again as the province sees a rise in new COVID-19 cases. More than 700 people have been admitted to hospitals around the province from October. So for more on this, I'm joined now by Dr. Luvuyo Bayeni, who is a technical advisor to the Eastern Cape Health MEC. Doctor, thanks a lot for joining us this evening. The province has seen a resurgence of COVID-19 cases. What are we attributing these rising numbers to?
Good day, and good day to the viewers as well for eNCA, and thank you for the opportunity for us as a province to express and extend our explanation as to what is happening in the province. Indeed, we have been seeing a rise in the numbers in terms of the hospital admissions, but we also would like to probably take this opportunity to give a bit of a clarity as well that most of the time the numbers that you would have seen or have been reported to, especially clocking up hospitals, the first impression that was reported was that coming from a private sector in the main, because you would understand that sometimes there are a number of beds and especially the demarcations in terms of the different category of specialties or different conditions, the numbers might be limited. So the first impression or the first indication for us that showed that indeed the health system might be in trouble was mainly from the private sector. However, we also do see some rise in terms of our numbers in the public sector as well, and especially in the areas where we had indicated that there is hotspot areas in the main, the Nelson Mandela Bay Metro as one of the areas of concern for us. But in terms of our cumulative numbers, we can report to you that at some stage when we reported this week, we had cumulative admissions from public sector of 8,976, and those of private sector were 4,043. Hence, I was saying the pressure point were felt even more when you look at your private sector beds, totaling to a number of 13,119 beds admissions that we had reported in our healthcare system.
Well, Dr. Luvuyo, in light of the data that is presented before you, is there a threat of a COVID-19 second wave in the province?
Well, yes, we are very much cautious, and as a result, today we had a session with that was convened by the MEC and the executive management team. And amongst the things that she had even instructed that we should be doing in the next 2 days was to then respond in terms of our strategy being adjusted for that sketch. But yes, the numbers are showing, and it's not only the numbers of the hospital admissions, but also, as you might have seen, the numbers of the actual infection as they rise. And what we can also agree to is that we have also had an interesting twist in terms of the infections of people that have got comorbidity, including mental health conditions, which is also another issue that is then facing a challenge for us, because as you might know, their admission requirements, some of them might need 72-hour observations, some of them might need long-term admissions. So that is also showing its angle that we probably did not anticipate. But as a province, we are attending to it. We had to adjust in terms of the allocation of beds, especially around the Metro Bay, having to make use of all the facilities that we have.
I mean, you've just said that you are fearing that there is a second wave in the province. Then do you have the sufficient resources and the capacity, or are you having to look to national just to beef up your resources in the province?
At this stage, we are quite confident that with what we have in the province, like I mentioned, it could be an element of just adjusting things there and there. As you might understand, that the health system as it is might have different categorization. In the Nelson Metro Bay alone, you've got your mental health, you've got your TB ward hospitals, you've got your general hospital, regional and tertiary hospital. So that was the demarcation before. But now having to respond to this, what it means is that we have to then constantly adjust, even if the hospital might have previously been named or declared or gazetted as a TB hospital, for instance, where we are able to find space, beds, and make sure that patients are admitted. Those are the adjustments that we are busy doing. The MEC has also been pioneering some other renovations, even in Doranginza, where we are now expecting to have an access to a 100-bed unit that is now being completed in terms of the renovations. So with what we have at our disposal, we have been making sure that we make maximum use of it before we can even say then national, please come and intervene. But currently we are confident with that our adjustments. Yes, sometime and again communication might be a challenge, especially internally with our employees and our social partners in the form of unions. But we are keeping them on board. We are constantly communicating with them, but we are still making use of the different platforms that we have currently in the province.
Dr. Luvuyo, we'll leave it there for this evening. Thanks a lot for joining us, shedding some light on that. Well, you heard it. The Eastern Cape is dealing with a second wave of COVID-19 infections.